Dear friends, today I'm going to talk about one very important topic that is called carpal tunnel syndrome. What is a carpal tunnel syndrome? There's something called, many times you have seen that many of you, your friends, or some family members, they get some kind of tingling sensation on hands or some kind of numbness, sometimes like electric sensation on the hands, and more of that during the winter seasons, during the night time, and we don't understand what is there. Really, these are our hands. In the hands, the nerves comes from the wrist to the nerves, and these bones in the wrist joint is called carpal bones. It's called carpal bone, and there's something called tunnels. The nerves is there which comes from this tunnel to the hands, and sometimes this nerve get compressed in this tunnel, and that's why it's called carpal tunnel syndrome. And the nerves are like a electric wire. When the nerves get compressed, the patient get the sensation like some tingling sensation, some burning sensation. Sometimes they get the electric shock sensations also. So what is the reason for this carpal tunnel syndrome? The region of the carpal tunnel syndrome is very common. The few regions which you have to understand. One is the diabetic in the middle age and elderly age group. Then the younger age group, that's called thyroid hypothyroidism, because in thyroid there's a water deposition in the hands and body that cause the compression of the nerves. And then third, sometimes obesity, where the patient had overweight, they can that time also these nerves get compressed. So these are three main regions. So whenever any persons, your family members get such kind of tingling sensation in the hand, get the check the sugar, thyroids, and need to see for the weight also. And how to diagnose this carpal tunnel syndrome? So diagnosis is done by the this blood test I told you. There's something called nerve conduction study, where we do the nerve test of the hand to see the severity of this carpal tunnel syndrome, if it is mild or moderate or severe. Usually mild or moderate carpal tunnel syndrome can be treated with the medications and treating the underlying cause, like treating the thyroid, treating the sugar, and by the controlling the body weight. But sometimes it could be the very severe, where the nerves get compressed very severe, and it's not controlled with the medications and the underlying etiology. So what we have to do in that case, we do some special test that's called nerve sonogram to see the nerve thickening and nerve compression, and then we have to do the small surgery to release the pressure on the nerve. This surgery is not very big. This is the daytime surgery. We just put a nick on the wrist joint so that the pressure on the nerves get released and patient get relief. So we have to, if the patient gets such kind of symptom, better to consult neurologist as soon as possible, so that you can diagnose very early and treat very early, so that it's not become very severe. Sometimes it become refractory also, when despite the medication and surgery also it cannot be cured. To find, whenever friends, whenever you get such kind of symptom, kindly do this test, consult neurologist, consult the blood test and the nerve conduction treatment studies, and treat the underlying cause and get treated well. Thank you very much, friends.